can expect to reduce the area by 15 to 28%, which is quite good, you know, considering that it's not liposuction, you don't go under the knife, you don't have, you know, massive, you know, side effects, and it's not life-threatening, you don't have anesthetics, you know, so it's really, and it's much friendlier, you know, pocket friendly. It's much cheaper than any of those other procedures I just mentioned. Yeah, so what are the risks and benefits? Well, there are a lot of benefits. The risks are quite few. So the advantages, we'll just go through them, it is a non-surgical procedure, which means you don't have any knife cutting your skin. It's non-surgical, it's low-risk procedure. There's no risk of infection because your skin is intact. There is no entry point for infection to get into your skin, which is why when we go down further, you see that if somebody has skin infection or lesions, you're not going to treat that area at all. You will let it heal properly before you treat it, or not treat it at all. Okay, so no anesthetics. The person is usually awake. It can be performed like in a clinic like this, in a doctor's office, in outpatient's department. That means you don't need to go to theater or anything like that. You're not sedated, you are awake, you know what is happening. I usually explain to my patients, my clients, I explain to them, like, you know, even where the automatic stop is, you know, is that safe? Look, if you feel the slightest pinch of pain and you think you don't want it, or pressure, there's usually no pain, but you can feel pressure when it's being pulled into the hollow. We usually keep our machine at pressure level 1. There's level 1 to 5. But I've ever only used it on level 1 because the level 1 pulls in enough to be treated. I've never needed to go to level 2. So for example, if it's on a higher pressure level, you could feel a bit of pain, you know, but we don't do that. But even then, I still tell my clients they know where the button is, the automatic stop is. If you don't like anything, or you don't feel like, oh, really, I don't want to go through with this, you know, you can pull that button anytime. But I'm always usually around somebody. One of my assistants is usually around. Yes, so what's more? Yeah, you can. So we're still talking about the advantages. You can treat more than one area in one session. So you could, you know, you could have like this is more than one handpiece in one. There are like 2 in this one, because I find that, you know, when I started, I was using like the usual, you know, hand pieces, but I found that a lot of the ladies that come, those pieces, they just like sit in the middle and just they do something, but not like this. This literally sucks in from left, you know, from left, right, top, bottom, and really just takes it all in there, and I love that. Yeah, so you can do more than one session at a time. You resume your normal activities just as soon as you finished, really. The procedure can be performed on people of all ages, provided they are suitable. Obviously, we're not talking about minors. There is no damage to your nerves or blood vessels or muscles or skin. You could have a bit of bruising. We'll talk about that later, but there's no lasting damage to any of your structures due to that treatment. Fat cells that have been removed, this is a key thing. The fat cells that have been removed, they are gone, like gone for good. They're gone. They're not coming back. There's no replacing them. You're not going to, you know, those particular cells, they don't magically come back. They're gone. If you don't maintain your diet, if you don't live a healthy lifestyle, the remaining fat cells obviously can accumulate more fat, right? And you know, so generally you need to carry on with a healthy diet, to just make sure that not just that area, but the whole of your body is in good shape. Yes, patients may experience an increase in self-esteem due to an improvement in their appearance. And as I was saying earlier, this can then have a cascade of effects. You feel, more confident, you're happier, you're more outgoing, you meet people, you do things that you normally wouldn't do. You go for dancing, all those sort of things. They can then have a knock-on effect in other areas of your life. And that's why sometimes when people ask, is this absolutely necessary? Well, probably not. But if you look at the benefits of it, if it's not affecting you, if whatever you're trying to treat is not affecting you, then probably not. But if it's affecting you in any way, it's making you withdrawn, it's making you self-conscious, you're not as outgoing as you would like to be, or it's affecting your relationship, your intimate relationship, you're hiding all of the time. If it's affecting you, deal with it. So, what are the disadvantages of cryolipolysis? So there are a few disadvantages. One, the procedure is recommended for only people who are in general good health. So it's not really a disadvantage as such, but basically you come and do this procedure if you're healthy, you're in general good health. We're not talking 100%. Nearly everybody has one thing or the other, but generally you are in good health. You are able to go about I'm not excluding anybody, disabled or people are not excluded or anything like that. But you are in general good health, So even if you're in a wheelchair, but you are in good health, your being in a wheelchair could be due to an accident or some other sort of thing. But if you consider yourself in good health, you're in good health, you can have the procedure. Obviously, we will screen that when you come for assessment. We would like to know if there is any diagnosis you have that may not be helped by the procedure. Then we will say, we will advise otherwise. And there are alternatives. There are other ways to remove stubborn fat deposits. Apart from doing cryolipolysis, there are other methods that can be used. So fat reduction is only in specific areas, so it's not for general weight loss. So that's the second disadvantage. And there is a rare small risk of skin surface, that your skin surface may be irregular a little bit. It's possible. When I went for my training, there was a lady when she had done her, this is many years now, she had she said she had a line, a small line, where, because she did it during her own training and the practice on each other, and I don't know how that was placed, and she had that little mark. So that can happen, but it's very easy to treat that. There are many treatments or therapies to use to just smooth that part area and level it and make it normal. So it can be corrected if it happens. I've never had any, but if it does happen, I know what to do to take care of it. And one treatment, yes, one treatment, you may need more than one treatment at a time for a particular area. So if you're treating an area that is fairly dense or fairly large, one session is not going to do it. You may need 2-3 sessions. So that's one disadvantage. But that's the same for most aesthetic treatments, and that's because they are created in such a way that you don't want to do anything that will be too much in one go, because if you cause a damage doing that, it's more problematic than if you do a little and then do a little later. It is safer for the client, it is safer for the practitioner. What else? Okay, so when you've had, so there needs to be a space of time between treatments. You know, so even if you're in a hurry to get rid of the bulge, you can't do it in a hurry. So when you've done one treatment, you need to give it about 4 weeks before the next one. So you can't do it like today and do another one 2 days later or 3 days. You can't do that. It's not allowed. Yes, so you do have to have that bit of patience to space it out. Another one is that results are not evident immediately. It's not like filler. If you put a filler somewhere, you will see the results as you're doing it, you know. And when that person picks a mirror and looks at their face, they will see, you know. And you actually have the discussion back and forth. Do you want a little more here? Or you want a little more there? Do you like it? You know, this procedure does not have that. You finish doing it, you go home, and you wait for the result. Yes, but the result does come. Results are not evident immediately. I've already said that. So contraindications. So this is one that I don't really see a lot of people talking about. So, but today I just want to bring this to light. I know that this is going to be on our YouTube channel, so it's not just for the people that are watching now, it's for the people who are going to watch anytime afterwards. So if you're morbidly obese is I don't really want to use the BMI, but it means that you are so obese to the point of danger, you know, or of ill health and that sort of thing, that makes time to do it. It's not really worth your time to do it, because you're just going to spend your money and you're not going to see the results, because it's too little. It's like a drop of water in the ocean. So you need, the whole issue of the obesity needs to be addressed centrally first, systemically first, you know, before you think of it. And so, yeah, so I'm having the warning to stop now. I think my video is too long. So the next one, if you have injured area of the skin, you can't treat that area. That's a contraindication. It must heal first before you treat it. If you have an area with varicose veins, it won't be treated. And so those are some of the contraindications. There are more contraindications, but I can't go through all of them. Raynaud's phenomenon, cryoglobulinemia, paroxysmal cold hemoglobinuria. So these are big names. And if you have any of these conditions, you will know. You would have been diagnosed with it. You will know. Disease, hemolytic anemia, and that's it. So if you have any of those, you will know that you have those conditions, and it will be best not to do the treatment. Do an alternative treatment to get rid of the fat cells. And autoimmune conditions that cause disorders like eczema, psoriasis, you know, those ones, they need to be assessed on an individual basis. So that's it really. Okay, temporary side effects for the areas that are treated. There could be slight ache or pain. I've never had that from my client. There might be mild discoloration, mild bruising, skin. All of these are transient. They're quick. They go away very quickly within a few days. Some within a few hours. I think that's all of it. If you have any questions, there are a few more things that I can't cover. If you have any questions, please ask me directly. Thank you for watching. Thank you. Lots of love, and enjoy the rest of your Saturday evening. Bye-bye. Bye.